In this video we will show you how to treat ulcers. Ulcers are sores or lesions in your stomach or the upper part of your small intestines. Ulcers develop when the acids that digest foods damage the stomach or intestinal walls. Connected to a variety of causes like stress, diet, and lifestyle, scientists now know that many ulcers are caused by a type of bacteria called Helicobacter pylori, or H. pylori. Left untreated, most ulcers will continue to get worse, so it's important to receive a proper diagnosis and make the dietary and lifestyle changes that will allow you to heal fully. Part 1: Receiving medical treatment. 1. Identify the symptoms of ulcers. Abdominal problems are often difficult to diagnose since the symptoms of any one problem are reminiscent of lots of different kinds of issues, including gastritis, pancreatitis, Crohn's disease, and a variety of other problems. It's important to see your doctor and arrive at a proper diagnosis if you think you may have an ulcer, so you can receive the proper care. Ulcer symptoms include persistent or recurring stomach or abdominal pain. Often with pain, there is discomfort or bloating sensation in the abdomen. 2. Consult your doctor to eliminate other possibilities. If you're having stomach problems, it's not necessarily an ulcer. Based on the history of your symptoms, your diet, and a physical exam, your doctor will be able to rule out the possibility or might advise further investigations to confirm it. 3. Get a diagnosis. Your general practitioner may recommend that you visit a GI, gastrointestinal, specialist, during which time you may go through the following tests which can be used to properly diagnose any kind of digestive ulcer. 4. Tackle the root of the issue. Ulcers need to be healed by addressing the underlying condition of the ulcer specific to you. That's why it is important to get a proper diagnosis and follow through with your doctor's recommended treatment. Most treatments involve medication, eliminating the cause of the ulcer, and dietary changes. 5. Avoid taking NSAIDs and aspirin. Aspirin and non-steroidal anti-inflammatory drugs, NSAIDs, can cause ulcers and can exacerbate the symptoms. Avoid taking NSAIDs while you have an active ulcer and for extended periods of times thereafter. If you need to take medication to deal with pain symptoms, ask a doctor about your options. In some cases, you might be able to take an NSAID along with an acid reducer or pursue alternative pain treatments. 6. Try over-the-counter antacids to help to reduce your symptoms. Often you will feel indigestion and heartburn, with burning and nausea in the upper abdomen under the ribs. Antacids can be used to provide temporary relief of symptoms, but will not ultimately cure ulcers. In fact, some antacids may interfere with the effectiveness of prescription medications, so talk to your doctor before taking them. Over-the-counter antacids choices include: Part 2: Changing your diet. 1. Avoid any foods that aggravate your symptoms. Ulcers vary from person to person, so it's hard to say what foods are good for ulcers and what foods are bad. For some people, spicy food may cause no problems, but olives or pastries may drive them crazy with pain. Try to eat a relatively bland diet while your ulcer heals and identify the things that make it worse. 2. Eat more fiber. Some estimates show that the average consumer gets about 14 grams of fiber a day. Try to get upward of 28-35 grams of fiber a day to treat your digestive tract right. A high-fiber diet that contains a lot of fresh fruits and vegetables helps to reduce your chances of getting an ulcer and helps existing ulcers heal. Try getting fiber from the following sources: apples, lentils, peas, and beans, Brussels sprouts, broccoli, and another brassica, berries, avocados, bran flakes, flax seeds, whole wheat pasta, barley and other whole grains, oatmeal. 3. Eat lots of foods that contain flavonoids. Some research suggests that foods containing naturally occurring flavonoids can help to heal ulcers more quickly. Flavonoids occur naturally in many fruits and vegetables, making them good for you to consume on 2 levels. 4. Try licorice root. Texas and supplements containing licorice root can help to heal ulcers and keep them from coming back. It's important to distinguish between sugary licorice candy, which can make stomach troubles worse, and natural licorice root, which is used in supplements and teas. Only use the latter as an additional treatment for ulcers. 5. Avoid spicy foods like hot peppers or spicy seasonings. Cut back or eliminate those foods from your diet. Although doctors now believe that spicy foods do not cause ulcers, some people with ulcers do report that their symptoms worsen after eating them. 6. Avoid citrus if tea bothers you. Acidic fruit drinks, including orange juice, grapefruit, and other citrus juices can make the symptoms of ulcers much worse. For some people, it may not be a problem, but it can be extremely painful for others. Limit your citrus intake if it seems to bother your ulcer. 7. Cut back on coffee and carbonated drinks. Coffee is highly acidic, which can exacerbate the symptoms of ulcers. Carbonated soft drinks and colas likewise can irritate your stomach lining and make your symptoms worse. Try to cut out your morning cup of coffee in the short term, if you're suffering from an ulcer, to try to heal up. Caffeine in and of itself doesn't make ulcers worse, but acidic soft drinks, some strong teas, and coffee do. Try switching to more gentle herbal teas, if you have an ulcer. If you need a little caffeine kick, try adding some guarana to your tea. Thanks for watching. Subscribe our YouTube channel for more videos.